Well, welcome everyone. Glad to have you join the podcast again. Lauren Ahern, our producer, how about telling everybody about this change in plans? Who we've got here today besides me, David?
Yes, so today we are joined by Dr. Dan Weiner, who is a member of the ASN Council as well as the Council Liaison to all of ASN's policy committees. So, hi Dan, welcome.
Hey, Lauren, it is great to be here today.
Fantastic. Well, we really appreciate you being here. You've got a lot of depth in the policy space, and you've worked with us for many years. So we've had a big event in the last couple of weeks, which was when there was a leak, but it was what they call a passback document in the budgetary process that was made, had been prepared by OMB and HHS had looked at it. Um, and it has some pretty significant concerning issues in it, such as a proposed $40 billion cut in the Department of Health and Human Services for FY 2026. Do you mind starting off and just telling us, pass back? Sounds like something a quarterback would do, but and we know how much you love sports. So how would you describe this?
Well, David, I never thought you would make an NFL reference, especially since the draft's going on, but I think it's a great place to start. Um, so the passback comes from the OMB, the Office of Management and Budget, and this is really one way in which the current administration is going to emphasize what its budget priorities are. So the agencies and the OMB will go back and forth in terms of how much money and to where that money gets allocated within HHS in this particular example. In some cases, this is a starting point for negotiations between the agencies and between the White House as represented by the OMB in this particular setting.
Okay, so I think we should just add for everyone to understand this is not the proposed budget that would be sent to Congress. That this is still the earlier part of the process. A proposed budget has to be submitted to Congress, and between now and recording this and releasing it, that could happen. But the reality is that until a budget is submitted to Congress, it is just that. It's somebody's proposal. But since this one was developed by the Office of Management and Budget, we kind of have to take it seriously, wouldn't you say?
I think we do have to take it seriously because it starts to show what the administration is thinking in terms of where its priorities are, in terms of what it wants to fund, and in this particular case, more notably, what it doesn't want to fund.
How about highlighting some of that for us?
Well, as you already noted, I think the most remarkable thing about this, ignoring the specifics, is really there's almost a 40% haircut almost everywhere. So, for example, the NIH, there'll be considerable reorganization in this particular example, but you're going to see a dramatic decrease in the amount of funding the NIH receives in order to sponsor both intramural and extramural research. I think the cuts are even most dramatic with intramural research, but those are examples of where we're seeing some of the changes more broadly.
So, Dan, are there any specifics here that jump out at you?
Yes, in this document, and again, we need to take this with a grain of salt because it's a starting point. There was a lot of consolidation and reorganization, as well as some very specific cuts, some specific items that were eliminated. For example, the National Institute on Minority Health and Health Disparities would be eliminated under this particular initial draft. Kidney X, which is relatively small money, but is really an important representation of the value that we place on kidney research, was eliminated in this initial proposal. There's a lot of other entities that are eliminated as well. For example, the CDC's National Center for Chronic Disease Prevention and Health Promotions budget was eliminated. So there's potentially huge changes here. Although, again, I think the biggest issue is this just broad overall 40% cut that would occur to NIH.
I agree. I agree that that is very concerning. I want to point out to our listeners that what is going on here is OMB is trying to, pull together its priorities for the Trump administration in HHS. One thing that should be noted is that the budget process that is going to be underway in the weeks ahead is actually going to be what we call a skinny budget. So a lot of the details that we have seen here may not be visible or public. They just may be incorporated into some bottom line proposed number. Um, but the bottom line is that you know, the reality is that Congress gets the last call, don't they?
Congress does get the last call. Congress is the one who decides what gets funded and what doesn't get funded. Congress decides what programs are authorized and what isn't authorized. So it ultimately makes the determination as to what even exists that can be funded.
Well, I think that what you just said is really important because um, you said the word authorized. There on Capitol Hill, there are authorizers and there are appropriators. And the budget is going to go to the appropriators. But a lot of these things, which are basically already in statute or have been funded before, would need to be authorized before, correct?
That is correct. There are items mentioned in this passback document that don't even exist yet. So theoretically, if Congress wanted to appropriate money to them, they wouldn't necessarily even be able to do that because there's nothing concrete that exists to which money can be appropriated. So there's a lot of work that has to be done here, even to begin to realize what is showing up in this passback document.
Yeah, it's funny because um, many eons ago, when I started working on Capitol Hill during the Reagan administration, there was always a statement on Capitol Hill, which was, "There's no without authorization, there cannot be any appropriations." And what we're hearing on Capitol Hill is that some of those people are falling back on that. So they're basically like, well, if this is what they want, they need to go talk to the authorizers. We're the appropriators, and you need to deal with them first. And that does put them in a strange kind of negotiating position, don't you think?
I think it is a very interesting position, especially given everything else that's going on beyond just HHS, and also especially given the very short time frame that they have, given that there was an election and a new administration that just came into power in January. So this is a much shorter budget timeline than we would typically see in other years where they would already be months and months ahead of where they are now.
And of course, as we've talked about on this podcast many times, that fiscal year ends at the end of September. So it's that actually is a very short amount of time to put together a budget and to actually fund the government.
If you think about the amount of reorganization that would have to occur with what was laid out in this passback document, that's a huge amount of work, a huge amount of logistics, a lot of administration that would need to be redeveloped and defined. And and it seems pretty challenging to envision how that would happen in such a short time frame.
I will also say for the benefit of our listeners, I would find it would be very odd for the administration to ask for this amount of reorganization in HHS and not do it in other departments. So what I'm saying is this thing could be delivered to Capitol Hill and they could be trying to reorganize the entire government at one time. And that's a big, heavy lift to do in such a short time.
Yeah, I think that's a huge lift when you look at how many other aspects of government are trying to be reshaped under the Trump administration.
Well, Dan, we have been on Capitol Hill. ASN has, and recently, and a lot of the appropriators, when asked about this, have had a very interesting response. And that includes Republican appropriators, which is kind of like, we'll see when they deliver us the budget, but we're not going to work on this without having a budget to respond to. Does that make sense to you?
I think it does. And I think if you look historically, and most notably in the last 20 years, funding medical research has been something that's been bipartisan. It's been popular, it's been successful. If you look at many of the analyses that have occurred, it seems to pay for itself and then some. So funding medical research is something that I think a lot of different people are going to want to do, and I think there'll be a lot of reluctance to have major cuts in this particular area.
Yes. We've had consistently bipartisan support of the funding of research at NIH, and particularly bipartisan support of NIDDK and also of kidney disease issues. Uh, that does not mean that we have a crystal ball. We do not know exactly what will end up happening, but it does not seem like this is a given in any way to me. How about you?
I agree. I think again, there's a lot here, and you can almost divide up into two different concepts: the 40% sort of overall cut, and then the fairly dramatic reorganization. I think there'll be a lot of reluctance, bipartisan reluctance to have cuts that are this dramatic. In terms of the reorganization, I think there'll be some reluctance to do that as well. Although there was already a movement in place last year among people who are leaders in that particular area. Kathy McMorris Rogers, who is in the House, and Cassidy in the Senate, who is a physician, to look at ways in which they could reform the NIH and really build upon what's already working to have it work better in the future. Some of these ideas are very good, some of them need some work, but it's an area for discussion. And I think anytime you have something that's as important as NIH, we can always figure out how to continue to improve it. So I personally hope that discussion moves away from cutting, away from changes that can really forestall a lot of the successful research and remarkable research and important research that's going on, in order to truly focus on how we can continue to do research and even do it better.
Well, you have been our kind of like guidance. You have been our leader at ASN on this area in this area for a long time. So, I mean, we are we are not taking anything for granted, but we are also not sitting back and just saying, "Oh, okay, you can cut all these things. We're not going to object." But we're also working with coalitions and other groups across kidney care. And I just, if you wouldn't mind just sharing your thoughts about kind of how that works in the kidney space, how ASN works, and how effective this has been.
I think historically we've been very effective. I think that ASN, along with many other partners in the kidney space, has been able to build broad coalitions. And you can see that success with something like Kidney X, for example, which has really appealed to the entire community, has had broad bipartisan support in Congress, and has been celebrated as a success, as something that's really drawn attention to the need for innovation to help the well-being of people with or at risk of kidney diseases. I think moving forward, we recognize that there are huge challenges, but we already have great relationships in place. So, for example, over the past several years, we've worked very closely with the CMS Innovation Center, CMMI, on the kidney models. And this has been a fantastic relationship where we're talking about really the same overarching goals, which is improving the health of people with or at risk of kidney diseases, and trying to figure out how to incentivize this, and really having a partnership with other members of the community, with government, as we all work together to try to optimize these programs. Some have been very successful, some have been less successful, but this is also how we learn. I think going forward, we're going to see the launch of the IOTA model in kidney transplant. We are going to see reforms made to HRSA in terms of the transplant infrastructure that are hopefully going to help patients and really exemplify the amount of teamwork that goes on in the community. I think we also have really good relationships with other patient and other professional groups in the kidney space. So the National Kidney Foundation and ASN and the American Society of Pediatric Nephrologists and the Renal Physicians Association and so many other groups are all aligned to really work on these goals together.
And how kind of I know you can't speak for the entire ASN council, but as a counselor, how would you rate these issues as a priority for ASN?
As a counselor, I think there are so many priorities that we are trying to deal with, but I think that we really have major shared goals. The first thing is making sure that people with or at risk of kidney diseases are able to get the care that they need in order to maintain their health, stop progression of kidney disease, live the best lives that they can. And I think, and everything that we do as a council and as an organization, that's ultimately our goal. In order to achieve that goal, we need to make sure that we have a workforce, and we need to make sure that we have research and innovation, and we have entities such as the National Institutes of Health that are funding this research and innovation. So I think if we roll that all up, there's really only one priority, and that is to improve the health of the whole population. But the way that we're doing this is through multiple different platforms, all of which are affected by the policies that really govern us.
Okay. So I don't want to put words in your mouth, but I kind of hear you sending the message that it's kind of like stay tuned. We're working on this. We don't know exactly where it ends. Is that correct? And I'm also going to ask you to give us your last words on this subject for today.
I think we do have to stay tuned. I think there are so many things that are happening very quickly. There are a lot of ideas that are being tossed out. Some of them will stick, some of them won't stick, and we need to continue to advocate for what we think is going to be the best for people who have kidney disease. So I think ultimately we do have to stay tuned. If I had to predict the future, which is always a terrible thing to do, aside from the Celtics winning the NBA title, I personally think that we'll end up with roughly similar funding for fiscal year 2026 as we do for fiscal year 2025. I think the political priorities of the current administration will mean that there are definitely shifts in emphasis. But I think that the work that we have done in the kidney community has put us into a place where we can continue to advocate strongly for kidney health and for treatment of people with kidney diseases, regardless of who the administration is or who the president is, because this is a topic that's impactful for everybody.
Well, thank you for joining us. I think that's really important. I also just want to point out, in addition to all the details you gave us, that the council has approved and we have it's signed on to a letter for the Coalition for Health Funding that very much calls into question and asks for support from members of Congress about this leaked budget and how important it is that this get addressed and be taken care of seriously. And it's got over 350 signatures. And this is one day at a time, but as many people as we can bring into the cause is really important, wouldn't you say?
I would say definitely. I think ultimately we need to have a community that is really all advocating for the same thing, which is for the health of people.
Well, thank you very much.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.